There are two occurs if they have bone loss in upper jaw. One is bone graft and standard implants or zygomatic. Which one do you think has higher success rate and why?
For the patients who have severe bone loss, especially in the upper jaw, we can perform zygomatic implants, which is a specific type of implant. We choose this protocol, one of these treatments, according to the patient's bone loss actually, and the situation and their systemic diseases. We decide the protocol and discuss it with the patients. Bone grafting is a successful solution when the patient has horizontally bone loss, so we can make it wider and we can place wider implants. Vertically, also we can do some bone grafting, but we have limitations, which is a good solution to create the anatomy like it was before the bone loss. Actually, bone grafting is, of course, better to have the old anatomy you have, but it has limitations. We have to harvest the bone from the patient's own body because we call it autogenous bone. Your own bone is the golden standard. But sometimes we're not able to harvest enough bone. And also in the healing period, when we place the graft there and waiting for the healing, it is minimum 6 months. Patients can't use any dentures. Nothing removable, no pressure. So it will be empty, the area. After 6 months, we place the dental implants and we wait 3 more months. So it has a very long waiting period. If the grafting area is not so wide for like 3 teeth area, so it's better to do the grafting because zygomatic implant is a final solution, I think. After that, you don't have a choice to do the bone grafting. But when you have the bone grafting, after years, if you have any problems, then you can also go for the zygomatic implants.
So even if they consider not getting bone graft, they need a quicker solution, they can opt to go for zygomatic right there.
Yeah, zygomatic implant is a very quick solution and also it is reliable because the cheekbone, the zygomatic bone, is a very strong bone. We sometimes in the same session we can use fixed dentures on zygomatic implants. They won't be zirconium, a softer material, but they will be fixed, so it's a very good advantage for the patient.
So is that something you figure out once the patient comes here? Or do you know beforehand that this patient might need a bone graft or, a zygomatic implant?
If we saw the X-ray, especially 3D X-ray shows us almost everything, so we can decide before the patient comes. But sometimes in the dental chair, we see something different than the X-ray. On the X-ray, the bone looks good, but on the dental chair, we see that it's infected. So we don't have enough place to put the implant, or it's not possible to put the implants. Or the patient's systemic diseases are very important to decide the implant type. So mostly we can decide before the patient comes here if we have the 3D X-ray, but sometimes things can change on the dental chair.
So out of all the dental implants procedures, do you have a favorite?
Actually, I think zygomatic implants are my favorites because it was also my PhD thesis, so I've been working on them for a long time. And I like to give the patient a solution because zygomatic implant patients has no alternative.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.